Okay, good. Okay, good. All right, today what we're going to be doing is what I call our dysfunctional family sculpture. If you recall from the other day when I was giving you some statistics about drug and alcohol usage, one of the things I said is that some professionals believe that 70 to 90% of our families are actually dysfunctional. Now, dysfunctionality does not just mean families with problems. All families have problems. If you've come from a family that doesn't have any problems, I'd like to get to know you because you are a true anomaly. So every family has problems, but hopefully not every family is dysfunctional. Dysfunctionality was diagnosed and evaluated, and sort of the concept was developed about 10 to 15 years ago for the lay people, for those of us, really by John Bradshaw. And if you're very interested in this whole concept of dysfunctionality, we have a series of 10 tapes by John Bradshaw in the Learning Resource Center that really goes through in detail about all the roles in the family and a lot more of the implications that we're going to be able to do today in this short time. But I think that it's very important because I think that we need to be able to identify what's happened in our families, the relationships that we have developed, the behaviors that we have adopted in order to figure out why we are the way we are. And if we need to make some changes, we can do that. And without that acknowledgement and that knowledge, we will never change. And so we have what we call the trickle-down effect, that everybody in a dysfunctional family will create another dysfunctional family and then another dysfunctional family. And so really that's what's happened since about World War II. World War II really changed our society a lot. Women were in the workforce really en masse for the first time. So it created a change in our relationships. It created a change in our identities. It created more stress. You know, after the war, we truly started making progress in our society that at a level that we had never seen before. And I think a lot of that stress has influenced our relationships and how we operate in our families. The other thing I like to emphasize is that we are going to use an alcoholic as the example in this family, but dysfunctionality can occur around many issues. So as you're observing what we're doing and hopefully participating, just because your family doesn't look exactly like this family doesn't mean that your family isn't dysfunctional. Dysfunctionality can occur with alcohol abuse, drug abuse, other emotional issues in the family, physical, mental, and emotional abuse, and just the ability to not relate to people in a healthy way. So there may be bits and pieces of this that sound familiar to you, maybe not for your own family, but in other families that you know. The other thing you need to consider is the fact that when you marry someone, you marry everybody in their family. So you may come from a relatively healthy family, but you may marry into a very dysfunctional family. And that is not a good thing. I mean, it's really, it makes your life very miserable if the person that you marry doesn't recognize the dysfunctionality, hasn't done something about it, and remains in that dysfunctional situation. So you really need to think about it not just within your own family, but in other relationships that you'll have. So let's start out. I need one man to volunteer. Okay, come on up here. So John, you're going to be the father in the family, and you're going to stand on the chair. Yeah, you got to stand on the chair. You're going to be a big guy. Okay? Now you get to pick the next volunteer, and it needs to be a woman.
Do I have any volunteers?
No, you need to pick somebody. You pick.
I'll choose Melanie.
Okay, Melanie? Okay, Melanie, you're going to stand right in front of John, and you're the wife in the family. You pick the next volunteer, and I don't care what gender they are. No, you pick somebody. Okay, so Sarah, why don't you stand over here? And Sarah, you pick the next volunteer. Claire. Claire, I'm sorry to do this to you, but you have to stand in the corner by the door. Quick escape route. Claire, you pick the next volunteer. Somebody up front, Elizabeth, why don't you stay right in your chair? Okay, so we have John and Melanie and Sarah, Claire, and Elizabeth, right? Okay, for this particular family, John is the father in the family. He's also an alcoholic. That's his issue. Now just remember, as we're going through this, whoever has the primary problem in the family is the person on the chair. And they're on the chair because it represents that they have control and power over the whole family. So even though it may not appear that way to some of you, John is not a falling down drunk. He goes to work. He comes home every night. He gets out his six-pack. He sits in front of the television. He watches TV. He goes to bed. He gets up and goes to work. It doesn't appear like he really is the powerful person in the family, but he is. Whoever has the primary problem, it can be the mother. It can be one of the children. I had a young man a few years ago say that his brother was the person on the chair. So it can be anybody in the family, but the person that has the primary problem is the person on the chair. And it's like everybody in this family sort of tiptoes around him. He's the elephant. You know the old saying, who's the pink elephant in the family? Or what's the pink elephant in the issue? That's it. And we sort of all just tiptoe around that situation. But again, he's what we would call a functional alcoholic. We think of alcoholics as being, the people on the street that can't take care of themselves. Most alcoholics have a job, have a family, and work very hard to maintain that image that they have. Melanie is the wife in the family. She is right in front of him, and John, put your hands on her shoulders, because actually what she feels all the time is pressure, as if there's a weight on her that she can't change. It doesn't matter what she does. Now, she's the chief enabler in the family. She's the perfect mom. She's the super mom. She's what we see now in a lot of families, a wife, a mother. She has a full-time job. She's doing everything. Now, the issue here with her has been from the very beginning that as much as she has tried to develop intimacy with him, it just hasn't happened. I mean, they've gone through the motions of doing what married people do, but as far as him really having any intimacy skills at all, he doesn't. So actually, she's thrilled, probably beyond what would normally occur, to be pregnant and have a child. And Sarah is the child. Now, it doesn't matter if this child is male or female. The gender doesn't really matter. It usually is the first child. She realizes that John's emotionally unavailable, and he's going to continue to be emotionally unavailable, and so she's going to develop a very close relationship with this first child. This first child is what we call the hero child or the model child. This child is perfect. And I'll bet you all of you know someone that's the model child. They're maybe on your teams, in your classes, in groups that you have. They're in the social settings. They're always the one making the right decisions, being perfect, telling everybody else what to do, getting good grades, being the good athlete, volunteering. This kid comes home, cleans the house, takes care of the kids. She's perfect. Now, I don't know what you think about that, but being a perfect teenager is not normal. Teenagers need to be teenagers. And her role in life should not be caretaking for everybody else. And it shouldn't be perfectionism. If this child is a female, like Sarah is, she's the one in the family that will most likely develop eating disorders. She will probably not have a drug or alcohol problem until late in life. These are the late life alcoholics, the late life drug addicts, late 20s, early 30s. If you can imagine living your life having everybody tell you how perfect you are. Your mother tells you, your friends, your teachers, your coaches, you're perfect. And in your own heart, you know that you're not perfect. I mean, nobody's perfect. So there's a gap between what everybody tells her and what her own reality is. And when she spends time alone, really thinking about her life, she really is not a happy person. But she keeps trying to develop happiness by being perfect. And it's a never-ending sort of battle that she has with the reality that she knows inside and the reality that she thinks everyone else has about her. So this is the person. Sometimes you'll hear about people in their 30s, 40s, and 50s. They suddenly develop an alcohol problem, a drug problem. They commit suicide. They jump off the bridge. They seem to be, you know, successful. I mean, she's the kind of person that will have a good career. She'll have a family. She'll marry someone just like Dad. She's going to marry someone just like Dad. It's inevitable. So now that pattern continues again, again, again. If this is a male child in the family, he will develop a very close relationship with his mother also. He'll marry someone just like his mother. And watch out if you're the woman that marries this guy, because his mother is going to be more important to him than you are. So it's important for men that you become involved with are healthy, have a healthy relationship with their mothers. It's very important that they have a good relationship with everybody in the family. But if you see that he can't go very far away from his mother, he's calling his mother all the time, that's going to be the primary female relationship for him. So that's not going to bode well for you in developing your own family, because the wife should become the primary female relationship for that person. So we see similar things happening with the different genders, but also many different things. Okay, so everybody in the room, point over here to Claire. Everybody. Make her feel really bad, because she's the rebel in the family, and she's over here isolated from everybody else in the family because she doesn't fit. She's the problem child. She's the child in the family that you would look at in any situation and say, all the problems in the family are because of her. And they'll do the same thing. She's the one that cuts classes. She's the one that drinks, uses drugs, has sex too early. She might get pregnant early. She's in trouble with the law. The police are calling your house in the middle of the night, telling you that your daughter's out, getting herself in trouble. She's the problem. Now, Claire, let me ask you this. If you look at this family from your perspective, what do you see?